I'm Dr. Venkatesh. I'm a nephrologist. I want to discuss a couple of things. I want to give my view on this program, CliniEx, which is done by Reddy's for physicians. This program is a very useful one, and it has got a very carefully designed program, which is based on what we call as the script running, or what we call as your normal diagnostic processes which we normally use on a bedside, like examination, history examination, collating that information, formulating a differential diagnosis. So this is an experiential learning. This experiential learning is kind of encapsulated by this CliniEx program. Therefore, we have a problem, and that problem is narrated as a story, and as a story is narrated, people tend to think about different possibilities in terms of diagnosis. Then you discuss this in a 2-to-1 one-on-one basis with experts, who's usually they are the moderators, and they're usually a panelist in the program. And unlike other programs, this is more of a discussion rather than a didactic form of teaching, where somebody asks a question and somebody gives an answer. It's not like that. There's an active participation of us. So in real life situation, if you're encountering this kind of a problem, and these problems, these clinical problems that are taken up for discussion are generally very close to what we normally experience in our real life. And therefore, real decision making, when it comes to how in this kind of a situation, how would an expert would like to think about it, and in the given limitation, how people who work in a resource limited environment will be able to mount over that crisis, or think differently, or improvise so as to come to a diagnosis reasonably safely, and therefore proceed forward. These are the kind of some of the inputs that people can or derive in the CliniEx program. That is probably its most important strength. So this technique, what we call as the script concordance testing, where as to every doctor, we all know that the moment you see a patient, or they start saying these are the kind of symptoms I have, automatically a script runs in our head because of our training, because of our understanding of the disease process and everything. And this script automatically runs during this program in all our brain. We observe it, then we formulate our diagnosis, then an opportunity is given, or a discussion is open, where people start interacting with each other and try to formulate the diagnosis. So it serves multiple purposes. One, to understand your thinking process better, to reflect on it better, and then to borrow information from others in the real world situation. So if I have this limitation, I can't do this in this kind of a situation, what can I do better? So by discussing with experts, we can kind of reasonably understand. That is the strength of this program. Basically, it's so close to the way in which we normally think. And we think in an experiential way, and we learn in an experiential way. That's the beauty of this program.